look at this man, you look so professional and you sound so professional. And
I love Dermal threads because it allows me to lift,
do you remember the story? How did I find you?
take aesthetics to the next level.
I need the best ever doctor for threads. And you gave me your name, #1 place in United States. How much are you willing to pay for your confidence? How much time, energy, and money are you ready to invest to get the previous, more authentic, beautiful, and younger version of yourself? I just got back from the conference of biohackers where we talked about natural health and beauty, and today I'm blessed to sit here next to PA Clarke, whom I was so blessed to find in my life. Hi, Clarke.
Hi, how are you doing, Iryna?
I'm very good. I'm so happy to have you here today on my show, What Everybody Wants to Know. And we have so many questions for you. So, Clarke, tell me, before we start really to deep dive into the conversation about the beauty, authenticity, and everything, what made you choose this helping profession?
Well, I would say I've always been part of the beauty world ever since, let's say, middle school. I've always wanted to look the part, look good, dress well, make sure my hair was perfect. So it's always been a part of me. And we all have something that we connect to from a very early age, which kind of predicts where we're going to be as we become an adult. So I've always been in the aesthetic, style, and fashion industry from a very young age.
You know, when I've seen you first time, I look at this man, you look so professional and you sound so professional, and I know how great is your job, but I looked the way you look and I understand we have to come back to this guy because he knows what he's doing. He's selling the beauty. He's offering the beauty to this world. What do you consider is the most important part of the body to pay attention to?
Part of the body, well, faces will always be number one. You know, when we meet someone for the first time, we're looking at the face. The face opens the door for everything else. So the face is what invites others to socialize or to introduce themselves. So we're always looking at the face. Face is the prerequisite for whom we're going to sleep with or marry or ask out for a date. It's always that face. So the face is the most important. And after, everything falls in line.
You know, they say that when you're falling in love, you're actually attracted to some visual triggers. Let's say your beloved caregiver had the same nose as your spouse, or, you know, the same front, the same ears, the same hands, or something similar. When you're working with people, you're definitely a little bit changing their personalities and their visuals. Do you think those changes can prevent you from meeting their destinies?
Absolutely, 100%. Um, Small changes in the way we work on the face can either accentuate the quality that someone wants or the quality that they're perceived as beautiful or young. Sometimes, if we don't get it right, even if it's a good job, we haven't done a good job because the person, the client, isn't satisfied. So it takes years to understand that what the patient wants isn't necessarily what the beauty standard is, but what the beauty standard is for that client. And every client is different based upon what they're looking for or the triggers that stimulates them.
You touched actually the standard of beauty, and nowadays you see there are a lot of trends. It was big chest many years ago. Now it's about huge buttocks. Do you follow trends while working with people, or you still think that beauty is very individual process?
I think it works together. Um, Quite funny. After the Vietnam War, it was all big boobs, big chest, and that is what the Americans were tied to. They had an affinity for that. Fast forward to 2000 plus, we have the BBLs, and those are the trends. Then we have the lips and the nose. What happens, I believe, especially in the US, is a trend comes along and we want it all. We want as big as possible, as full as possible in your face. And then that trend slowly slides into equilibrium, where we're not looking more for the extenuating feature, but we're looking for the harmony of that feature with our body. So trends start really high and aggressive, but then they always come down, and that's something we have to get used to.
And do you know any upcoming trends?
I think most things have been worked on that can possibly be worked on, but trends have a lot to do with the products that are being made. For example, your clothing. The trends of your clothing depends upon the material. Denim jeans, for example, 20, 30, 40 years ago, the major change was the quality of the material. Different fabric types, stretchy jeans versus stone-washed jeans versus many other types of fabrics. In this industry, you can correlate the same thing, where the type of products being used mostly kind of dictates what the trend can be. So one of the latest trends was just after the lips was the chin and the nose, and we found that even though there are problems with the nose, we found that the material itself being used, for example, high G prime fillers, different types of fillers gives us the ability to make those trends happen. Sometimes it's also cultural. Sometimes we are looking at trends stemming back from other countries. We had the Brazilian BBL, as I mentioned, but then we have the Asian feature that's becoming a little popular with a more of a sharper chin and a softer jawline and a smaller tip nose. I've seen that a few times, but some trends are also hit and miss. Some trends you think it's going to happen, but it just doesn't. And it really just depends on the quality of the product to allow us to make that trend happen, if we're into that sort of thing.
I watch in social media, of course, because my business is present there, so I have to observe all trends. I've been looking into Japanese doctors. I was curious about it. I don't want to do anything with my face so far, thank God. But I've seen they do a lot of operations and they do it pretty good. But do you believe when you're crossing the ocean and you do it with the doctor with the hand from the other part of the world, maybe they're specialized just in Japanese ladies, or you think, and gentlemen, of course, or you do believe they can do good work on us as well from overseas?
But first, we have to look at the style of work that's being done and the population that's being worked on. So the Asian face is somewhat quite different than the Caucasian or the black Afrocentric face. All right? I find that when it comes to Japanese, Korea, China, the culture of learning medicine and surgery is more of hard protocols. And therefore, they may consider one type of nose as beautiful, and that's just that one nose, and everyone gets the same nose. Everyone gets the same chin. Everyone gets the same jawline and the same cheek. So you tend to find that the standard of beauty is very narrow when it comes to the Asian way of aesthetics. So if you were to go to South Korea, for example, you're not going to get a surgeon who's used to diverse populations. So you'll get a surgeon who would believe that his style and his Asian style of beauty, he would try to put on you. Does that make any sense?
Yes, absolutely.
It makes sense. So the type of training that occurs in some of these regimental countries doesn't work well with vast differences in populations based upon the features. So from an anthropological point of view, I think it's very narrow the way the surgical outcomes or the injectable outcomes occur.
You have your own podcast and you speak a lot about the beauty, about new trans materials, etc. I would ask you, with your expertise, what is your favorite material to use?
I would say hands down is dermal threads. Dermal threads will revolutionize the industry. It definitely will. The only reason it hasn't is because dermal threads are not as easy to learn as toxin, Botox, or fillers. For example, I can teach a group of interns how to inject botulinum toxin, and within 1 to 2 years, they're all really good at it. I can teach interns to inject fillers, and within 5 years, they're relatively very good at it. But threads takes, you really need that 10,000 hours, sometimes more. So we're talking of 10 plus years of doing threads regularly. I don't mean going to someone who injects, half of the week, and so maybe they're seeing 1 or 2 thread patients a month. After 10 years, they still don't have that experience because it really takes hours in the chair of adjusting the facial tissue to get the right result. There are many different layers to the face. And so when you're administering threads, having that cannula navigate to the right place is one of the most difficult things to do. And therefore, you will never have the abundance of practitioners who either love or capable of doing dermal threads to the point of near perfection. It's very, very difficult. I love dermal threads because it allows me to lift the face. For example, toxin will relax the face. And we need all three. We need toxin, filler, and dermal threads. Toxin will relax and give a more welcoming, vacationed face, relaxed face.
I love this too.
Absolutely. Fillers will revolumize the face. As we get older, we lose volume, temples lose volume, forehead lose volume, jawline, chin, nose, mouth, everything loses volume over time. The skull, the bones of the face get smaller. As they get smaller, where does the skin go? Where does the fat go? What happens to the muscle? So we have elongation and falling of the tissue over time. Fillers will revolumize the curves, the angles that you had in your face. But what actually lifts the face up? What lifts the brows? What lifts the nose? What gives a vertical lift? Fillers cannot give a vertical lift. They can compensate and give an illusion of a vertical lift. But a true vertical lift comes from dermal threads.
So I have a question. In which parts of the body can I put those threads?
Anywhere in the body where the tissue, the skin and adjacent tissue allows movement. Threads require movement because the dermal threads will fix tissue from one place to a second location within a few millimeters. And that's all the face needs, that's all the body needs most of the time. We're always going a few millimeters up or sideways or diagonal. We're never going inches away from where we are because then we're distorting the body too much. So dermal threads can go anywhere in the body where the skin tissue, dermis, subdermis, fatty tissue, subcu, fascia, and muscle. Anything where it's mobile, the dermal threads, depending on the type that's used, can reposition that tissue higher or in a position that's more amicable for the client.
Want to learn how to love yourself and build up healthy relationships with yourself and others? Download Gemini Near Me. It's your one-stop shop for all self-discovery tools with access to the community of like-minded individuals.
Do you remember the story, how did I find you?
No.
I'm not sure you remember. So I did ChatGPT,
Okay.
which is very knowledgeable and usable nowadays. And I said, I need the best ever doctor for threads. and you gave me your name, number one place in United States. And I know you have two businesses, two locations. I know you're
Yes.
based in New York and you're based here in Florida in a very beautiful space. And tell me, besides that, you're doing as well, you're practicing, you're giving some classes for the students about threads or about everything else?
But predominantly about everything else. I reserve my derma thread teaching for practitioners with many years of injectable experience and a good sound knowledge of anatomy. Without a sound knowledge of anatomy, it's hard to teach another practitioner what they're actually doing because we cannot see the tissue behind the skin. We cannot see the tissue behind the skin. The skin is very thick. So we can only approximate with adequate knowledge of, for example, cadaver anatomy, allows us to see what we're lifting, what we're moving. Without this anatomy, it's almost impossible to become a very good thread specialist, but there's no one thread specialist. This is why it's hard to find that term. Understanding the anatomy well allows us to really take aesthetics to the next level. That's what I mean by dermathreads revolutionizing the aesthetic industry, but it will take time. And that time is for practitioners to become accustomed, familiar, and understand what dermathreads are capable of and the ability to actually perform good dermathread lifting.
You remember I came to you one time and you looked at my face and said, Iryna, you have temples to be fixed. I tell you, I'm perfectionist. I'm very tough of myself. I know all my problems. I'm so bad because I always want to improve. I know how to stop, or maybe I don't. That's a separate podcast. But you rediscovered my threads, and after I saw all the time those holes in the temples, I didn't see them before.
That's right.
So, Clark, tell me, when patients come to your office, before and after, what are their experiences? Do we rediscover ourselves and we find out we have to fix so many things, or we leave confident after those things are already fixed?
I would say it works together. A healthy patient is one who steps into my office already with some confidence. We cannot have 100% confidence because we all have trauma. We have trauma in our lives, we have beauty standard trauma as well. So we would never have 100% confidence. But understanding the limitations of the treatment itself and an understanding of who you actually are. You know, if you were 100% Chinese, for example, Asian, full face, rounded circle shape, you cannot ask to look like like Kardashian, like Kim Kardashian, for example. It just will not happen. Surgical wise, it can happen, but that's a lot of work, that's a lot of money, and the outcome still may not be that good. So understanding the limitations of where your beauty is. There are different face shapes and different face types. Understanding your face shape and type tells you the best possible scenario for your beauty journey. For example, we look at some celebrities. I ask my patients to bring in photos of sometimes their favorite celebrity or whom they think they look closer to and what they would like to look like. Based upon that, I can educate them as to what's the probably best scenario for their aesthetic journey.
And there is any celebrity that you would like to work with and maybe make some changes?
I, there's so many that I just love. Sometimes it's disappointing to see the direction that they go, but honestly, I have yet to see a challenging phase that I feel I would have difficulty with. Most of my challenges come from the psychological aspect of the patient. However, I will say again, the Bella
Hadid.
Hadid, she has an outstanding facial features. Outstanding.
Yeah.
Not everyone can have those features, and I don't care how much makeup you purchase, it's just not going to happen. Everyone has their own arena of beauty. And sometimes, going back to that confidence that you mentioned, sometimes understanding that you are beautiful where you are. You are beautiful where you are. Yes, everyone needs a tweak. Everyone needs a little push, a little pull, a little tuck, a little knit here and there. But we're all beautiful. If you can tap into that, you'll probably make better choices as to what beauty treatments are going to work for you.
And where is this like, thin line between self-love, self-acceptance, and self-improvement?
Knowing the limitations. Knowing the limitations of where you can be and what can occur. So typically, if you have a patient, if say you're walking on the beach and you come across someone where the lips are overblown, the cheeks are way too high, way too full, and there's obvious work done and it just doesn't look attractive enough, you can see that the limitations were bypassed by that person. So understanding that the shape of your lips dictate the style of lips you can have. And if your practitioner doesn't understand that, or you don't understand that, you're not going to have attractive lips. You may have done lips, you may have full lips, you may have large lips, but you're not going to have beautiful lips. It's not going to work. It's like trying to fit a size 9 foot into a size 6 shoe. You can get it there, but number one, you can't keep that shoe on. Number two, it's not going to look good. So knowing the limitations of the treatments allow both the practitioner and the patient to make healthy choices and decisions.
I love your psychological perspective. You should be a very good psychologist to read people to understand them. But have you ever had the clients that you felt like she can't solve this lady? And have you ever refused your clients?
I have refused many types of treatments, but there's always something that can be done. So I have never refused treating a patient, but I have refused treating particular areas on that patient. Because there's always something that can be done. Say you're coming to me and everything was already done, and but you want more of something which doesn't really work well. There's always something else I can find to increase the attractiveness of you. It doesn't always have to be that one thing that the client is asking for. Now, if the person bypasses your opinions and your choices, then this is a great avenue to have that patient come back within a couple of weeks or a couple of months to reassess. In this day and age, we live in a world where, we have to pay the rent, we have to pay the mortgage, we have expenses. And therefore, sometimes I find that like any industry, whether it's medicine, veterinary, dental, real estate, you're always going to have a handful of practitioners that will always overdo based upon what is coming through the door. But I would say there's always something that can be done.
And what is the best thing you wish your clients could understand about your industry?
All products are not the same, especially when it comes to fillers. There are many different types of fillers. There's about 20 plus fillers in the United States and over 150 fillers worldwide, different types of fillers. Each filler does something different. Some fillers are remarkable for the lips, others are amazing for the chin, and they cannot be used vice versa. For example, there are some fillers that are wonderful under the eyes for the dark circles, or the hollowness, or the sag in the cheeks. And that filler cannot be used anywhere else. Doesn't work anywhere else. So every filler is different. What we don't want to do is listen to an advertisement on the radio and say, I want to have that product in my face. This is like saying, well, I have a cold and I want doxycycline. You cannot choose the drug because you're not educated about the drug. You're not educated about the filler. So you may have clients who may say, well, I want filler in my cheeks. It's not that simple. Yes, it's simple to the less educated practitioner. You just grab a filler, put it in the cheeks, Maybe it looks great, maybe it looks good, and that's that. But no, but what about the longevity? What about the movability of the filler? Is it going to migrate? Is it going to move in different places? Does it have a high potential for creating lumps or bumps? Does it have a high potential for for not being able to be dissolved easily? Different fillers carry different values. We call them the rheologic values. These different scientific values of the fillers determine what those fillers can do once they're injected. Now, when they're injected in the lab, it does one thing. In real world, it may do something slightly different, and that is where anecdotal information and evidence come in. When we inject patients, we get a chance to understand and see what that filler does in real life, besides what the labs tell us, besides what the marketing tells us. Marketing may tell you this part is wonderful for the lips. In real life, it just may not be. So marketing is designed to sell a product, but ask the practitioner and the client, if both are educated to a decent degree, they would always make the best choice for the type of filler used.
People like to be self-medicated.
Absolutely.
Tell me,
Absolutely.
please, what was the worst scenario or challenge you faced redoing somebody else's previous job?
Dissolving a filler that was just extremely stubborn to dissolve. And two, removing silicone that was implanted many, many years ago. So I've had many patients who have silicone in their lips, silicone in the nasolabial folds, or silicones in the cheeks. And, you know, it's not always successful to remove the silicone. You can never remove all of it. But there are certain things you can do to reduce the visual effects of that silicone.
And do wives usually hide from their husbands that they're doing something?
Absolutely. This is part of the game.
They
Yeah.
like to sneak and maybe take some family money and
Yes.
here,
Yes.
Clark, please, like, don't say where I've been if you meet my husband. Do they do that?
Yeah, of course. Now, here's the thing. Every husband, every partner wants their partner to look amazing, right? Every husband wants the wives to look amazing. But sometimes these husbands don't understand what it takes. You know, life has its challenges. And we live in a world where things become expensive if they're good. And if they're great, then it's even more expensive. But at the end of the day, your beauty and what you look like dictates how you treat yourself, but also how you treat your spouse, your kids, your co-workers, how you treat the world. So sometimes I might treat one person, but secondarily, I'm treating everyone around them as well. Because if you're happy, you're going to treat yourself and everyone else around you a little better.
You know, it's interesting. I'm telling to my husband everything. Maybe it's even stupid, you can call it that way, but I go with him to do procedures not because he's controlling, he's very loving, caring, I can do whatever. But I tell him because I feel guilty that I didn't tell him the truth, even if it's so personal and intimate. So I did 0.5 mm in my lips and I told him. And so at least I know there is no secrets in this family. But you know what is interesting? Tell me one huge successful story, because I'm sure you had some. Let's say woman did something, I don't know, she did her front, she did her this Jolie line or something, and she met the love of her life, and she's writing you a note, Clark, you invited for a wedding.
But a lot of that you can see on my reviews. You know, but I will tell you, there was this one individual that came to me, and you know, and sometimes you know, my clients are crying before anything is done because you know the trauma in their lives from aging. Aging has its own trauma, so the trauma from just aging, especially if you were beautiful younger, there's a deep fear in losing that beauty. Beauty is an asset. And when we lose it, it becomes terrifying. So I had this one patient, and after the treatment, you know, she told me that she remembers looking like that, meaning that we were successful in rolling that clock back significantly, that she looked like herself 10 years ago. that is what we try to do. Our goal is to bring that patient back to a happy place based upon the visual outcome with the treatment. And if you're not getting those stories at least once a week, then you have to go back to the drawing board as a practitioner to understand what you're missing. Beauty runs the entire world. Beauty runs everything. And it doesn't matter what you have or don't have, you will always go after beauty.
Tell me where our listeners can read your reviews of your works.
So Google reviews, I believe is just the simplest, easiest, and most honest area that you can find reviews. And I do have my website where they can see a handful of testimonials as well. But also to understand the aesthetic industry well, I wrote a book 2 years ago, and it's available on Amazon, and the title is The Lust for Medical Beauty. And this book chronologies some of my journey, but it really talks about the aesthetic industry and what is entailed in this beauty world itself. So I think viewers can get a tremendous amount of information, some entertaining, some more educational from that book alone.
Clark, and I want to ask you the final question, but it would be personal. Tell me, how does your work influence your personal image? When you invite your friends for birthday, do they come and tell you, Clark, can you bring little Botox here at home? Do they bother you for that?
Well, I would tell yes, everyone wants to look beautiful, including
Yes,
myself.
we do.
So I tell everyone I do treatments myself. I sell what I do. I live what I do. Everything I speak to you and the audience about, I do to myself as well. I'm on the same program, the same fillers, the same toxins, and yes, every individual within close proximity, wants to be connected to that. We are connected to our beauties so intimately that no matter what is happening in the world, you're going to look at your beauty, you're going to look at how you look.
You remember that song "Man in the Mirror"? Starts from that "Man in the Mirror."
Yes,
I think it's Michael
yes,
Jackson.
yes.
There is any little secret you want to share with us, like to give a good example what you've done for yourself? Maybe something little. I know you're a manly man, but
Yeah,
still
yeah, yeah.
interesting to know that because you look so natural,
Well,
that looks untouched. But we want to know.
yeah, listen, because I'm a manly man, I'm happy to say I have my fillers in the areas that accentuates my masculinity. Women get fillers and treatments done to accentuate their femininity, but for myself, it's my jaw angle and my cheek angles as well. So notice I'm saying the word angles. We all have angles, lines, and curves in the face. It's all geometric shapes. And bringing these shapes together harmoniously can create a message. The message I want to give to my family and my clients and my friends is that looking healthy and looking good is a way of life. It is a choice, but your beauty is your asset. Without that asset, life is harder.
Absolutely, yes. And final question. What is your opinion on hormone therapy for men and women?
My opinion is this, to be quite frank. Many of the studies, for example, the Traverse studies, were kind of misleading, many years back. And, common sense sometimes tells us what we can venture into. If you're before the age of 30, your hormonal levels are pretty high, very high. After 30, 35, 40, they're lower. Naturally, by 40, by 50, they're lower. Why do we, as a nation, wait for problems to happen before we address them? So hormonal therapy is there for us to address issues before they happen. There are many pre and postmenopausal women that suffer because the practitioners do not talk to them about hormonal replacement therapy. Hormones is your life. Hormones is what governs your entire life, your psychological health, your physical health. Hormones are more important than anything else in your body because it keeps your heart strong, it keeps your organs alive, it keeps your whole body moving forward. As you get older, it declines. Why would you wait until 60 to start taking your hormones if they start declining at 30?
Don't wait. Act now.
Don't
Clarke.
wait, act now.
Clarke,
Yes.
thank you so
Oh, my
much. Such a
pleasure.
pleasure.
Absolutely,
Always happy to
Iryna.
come back to you.
Thank you so much.
And stay beautiful, but always be yourself. And with outside beauty is here PA Clarke to help us, and with inside authenticity is beauty. It's always Gemini Near Me. Up your self-help and self-love, up with two-way conversational 24/7 pocket counselor, Iryna AI. We're always there for you.